morning, everyone. So this morning we are speaking to Annegret Wilsdorf. She's a physiotherapist and she's going to be going through some frequently asked questions about backache and related to pregnancy. So we're going to try and cover as many questions as we can to help you get the answers that you need. So good morning, Annegret.
Good morning.
Great. So we're going to start off with a few questions on backache, and we want to know, what are the causes of backache during pregnancy?
So back pain in pregnancy is very common and should and can be avoided, but about 50 to 80% of pregnant women do struggle with back pain during their pregnancy. The body does go through quite a lot of physiological changes, of which the musculoskeletal, postural and uterine changes probably contribute the most to developing back pain during your pregnancy. Low back pain usually occurs between the 5th and the 7th month of being pregnant, but it can even develop as early as 8 to 12 weeks. Women with a pre-existing back condition are unfortunately at higher risk of developing back pain during their pregnancy. So three things that we probably think that contribute the most to back pain during pregnancy would be strain on your back muscles, weak abdominal muscles, and then also the hormone changes that develop during pregnancy. Strain on your back muscles occur because you have this growing uterus in the front of the body, and obviously that uterus becomes heavier and the spine has to curve and accommodate that increase in weight as the pregnancy progresses. So to keep your body in balance and to keep your center of gravity in place, you might lean forward or you might lean back a little bit, and in that case that puts a bit of extra strain on the back muscles. Weak abdominal muscles, they obviously support the spine and play an important role in the health of your back. And these muscles become quite stretched as the uterus grows, and this unfortunately puts you at higher risk of hurting your back with normal daily activities or during exercise. And then the last one that I just mentioned was the pregnancy hormones that also prepare you for labor, and relaxin is the hormone that helps to relax the ligaments and the joints of the pelvis. But unfortunately, this little bit of loosening of the joints also contribute to a little bit more flexibility and can also cause back pain because these joints become too mobile.
What is sciatica, and are there other forms of back pain during pregnancy?
So sciatica is the term that we use to describe the nerve pain in the leg that is caused either by irritation or compression of the sciatic nerve. So sciatica originates in the lower back and radiates deep into the buttock and travels all the way down the leg. So lumbar pain during pregnancy is generally located at and above the waist in the center of the back, and lower back pain in pregnancy may be associated with sciatica or it may not be, but sciatica is definitely this referral pain down the leg. So the typical pain that you will feel with sciatica is either a constant burning or a sharp shooting pain from the lower back through the buttock, and it might even radiate as far down as to the foot. There might be some numbness experienced with this pain and even some tingling, like when you have your foot is sleeping, that sort of symptom, and it is usually just one-sided. So other types of back pain that you can experience in pregnancy is pregnancy-related pelvic girdle pain, and I just have a quick model here. So if you can see the pelvis that I have here, you have the lower part of the spine enters here. You have two joints on the side here, which is your SI joints, your sacroiliac joints. And then you also have a pubic symphysis, which is right in front. So if you had to look from the side, the stomach would be on this side and the buttocks would be on this side. So you have these two joints at the back that could be painful with posterior pelvic pain. The coccyx right at the bottom, so the tailbone, and then the pubic symphysis right in front. So any of those three areas could become quite painful during pregnancy. And it's also quite a deep pain that's felt in the pelvis. This pain could be on both sides or it could be one-sided. It can radiate all the way down into the tailbone. You can even experience pain in the back part of the pelvis, but then also in the front part where the pubic symphysis is. This pain can radiate all the way down to about the knee, but this pain, different than sciatica, doesn't actually really pass beyond the knee into the foot. It normally disappears in the area of the knee itself. So posterior pelvic pain during pregnancy can be brought on or exacerbated by different activities, and that would be rolling in bed, climbing stairs, sitting and rising from a seated position, lifting, twisting or bending, and then of course running and walking. And a job that involves prolonged sitting positions can also be big contributors to pelvic girdle pain during pregnancy. Or if you had a job where you had to lean over a workstation for long periods of a time. Unlike any other forms of low back pain in pregnancy, a previous high level of fitness doesn't necessarily prevent posterior pelvic girdle pain from developing. So the last form of low back pain that you can experience is labor pain during pregnancy, and this shouldn't be confused with sciatica or pelvic girdle pain. Labor pain falls in a slightly different category. This pain is persistent. It increases with intensity and frequency over a very short period of time, and it is not affected by the level of activity that you do. And of course, with labor pains, get hold of your obstetrician or midwife or hospital as soon as possible.
Okay, so now knowing all these pains and where they stimulate from and how they come about, is there anything that pregnant moms can do that to avoid the back pain or prevent?
Yes, so
yes,
to try and prevent back pain, definitely. So make sure that you wear comfortable shoes. They shouldn't be too flat, but they shouldn't be too high either. That just changes your posture quite a bit, and that can add to the strain of the other areas that we spoke about earlier. Make sure that you also have a firm mattress that you sleep on. Try not to bend from the waist when you are picking up anything. Some women might have small children at home as well, or in a job that they are required to pick up quite a few things. Rather squat down, use your legs, bend your knees when you have to pick up anything. If it is too heavy, rather get some help. Make sure that you sit in a good, comfortable, supportive chair. If you have a small pillow handy, you can also put that in the lower part of your back, and try to sleep on your side with either one or two pillows between your knees. That definitely helps to make it a bit more comfortable at night.
Okay, and is there anything that the pregnant moms can do to ease the pain?
So regular exercise is of course very important. This helps to strengthen your back and also keep the abdominal muscles as strong as possible to support the back, and also make sure that you try to maintain a good posture with anything that you are doing. Might it be at work or even doing chores at home or any sort of other exercise that you continue with. It also helps to prepare you for labor and childbirth if you are as strong as possible. If your exercise regime or taking a break, resting from certain activities that can cause back pain, or applying heat or cold to the area doesn't relieve the problem, you can always visit your nearest physiotherapist. They can also help with recovery of your back pain, and there are specific manual therapy and soft tissue techniques that we can use during pregnancy that are safe for pregnant moms. You can also use maternity belts. And there are different maternity belts available to support those joints that are so uncomfortable and cause your back and pelvic girdle pain. And then, of course, there is also a guided rehabilitation program that you can follow in different levels of strength and activity to also support you through your pregnancy and in this back pain period.
What exercises are safe for pregnant mummies, and what are the benefits?
So if you are healthy and you have a normal pregnancy, it is very safe to continue with a regular exercise regime. Exercise would not increase the risk of miscarriage or low birth weight or even early delivery. However, it is important to discuss which exercise you want to continue with your obstetrician and members of your healthcare team. So regular exercise has many benefits during pregnancy for you and your growing baby. It reduces back pain, it can help ease constipation, it may even decrease the risk of gestational diabetes, preeclampsia, and having a cesarean delivery. It promotes healthy weight gain during pregnancy. It also improves general fitness, and it can help lose that extra weight that you gain during pregnancy once baby is born. So the safest exercises to continue with during this antenatal period is, of course, walking, a nice brisk walk, swimming or doing aerobic workouts, water aerobic workouts, a stationary bike. Best to stick to a stationary bike, as being out on the road or doing mountain biking is, of course, a risk of falling, and it is just safer to stay on a stationary bike. And then, of course, very popular is modified yoga or Pilates during this antenatal period, which definitely helps to strengthen up the body, increases flexibility, and it definitely helps to decrease the stress in this time as well. So if you are an experienced runner or jogger or racket sports player, you can continue with this during your pregnancy if there aren't any other risks involved. But just make sure that you also just discuss this with your obstetrician and members of your healthcare team.
What precautions should I take during exercising?
So it is important to drink enough water before, during, and after your workout to avoid any dehydration. Wearing a nice supportive sports bra to just protect your breast is also advisable. Then make sure that you don't become overheated, especially in the first trimester. Swimming is, of course, a lovely exercise to do, but just make sure that the temperature of the water is not too hot and that you don't feel that you are overheating in this period. Pilates and yoga are wonderful exercises to continue with during this antenatal period. Many of these exercises require that you do lie on your back for longer periods. With the growing baby, there is some pressure in the abdominal cavity, and there is also a big vein that runs in the back part of the abdomen, and this growing baby could cause some pressure on this vein, which might make you feel quite dizzy and faint when you get up or change from that lying down position. So just take care in that position in your exercise class, and also avoid standing still for very long periods. You might get some pooling of blood in the lower extremities, and that can also contribute to feeling dizzy and faint.
What are the warning signs that I should stop my exercise routine?
So if you experience any bleeding from the vagina, or that you feel very dizzy or faint, shortness of breath before you even start with your exercise regime, any sort of chest pain, headache, muscle weakness, calf pain or swelling in the calf area, regular contractions or painful contractions of the uterus, and then of course any sort of fluid gushing from the vagina or leaking from the vagina, you should definitely stop with your exercise regime, and then also please contact your obstetrician as soon as possible. If your back pain is very severe and very persistent, I would advise that you contact your obstetrician as soon as possible, or any other members of the healthcare team. Back pain is a symptom of preterm labor, but it can also be a sign of urinary tract infections or any other sort of problems with the pelvic organs. So contact your doctor if you have any fever, burning sensation during urination, or any vaginal bleeding with this back pain that you are experiencing.
Okay, great. Thank you so much. Thanks for sharing your insight on these questions of all the back pain and related to pregnancy. And we really hope we've helped with the pregnant mommies and their questions that they had in the back of their mind.